Thanks, Chris. Appreciate you putting that presentation together. Chris was not able to join us today live for the Q&A portion, but a colleague of his, Steve McCarthy from Curative Connections, is joining us. So just to pick up the thread there where Chris left it, thought I would ask Steve to talk a little bit more about the background about why the Population Health Collaborative approached Wishin to become involved, and how that happened, and then what that future looks like once we get through this initial stage.
Yeah, so we kept coming up against roadblocks for how can we more efficiently share our roster information. And so once we talked more with some of our colleagues and understood that really, you guys, it's a great health information network. That's really what you guys do, is manage that data. We realized that the legal framework was in place, the organizational structures are in place for Wishin to be that vehicle where we can transmit the roster information to the community information system. That information then goes out to the community programs, the health systems, and the family care and IRIS organizations. And having that information updated, whether it's daily or weekly, I just can't overstate the significance of how important having real-time information for the entire universe of people in the system that we're talking about. And the ability to expand this model to other parts of the state, yeah, that should be transformative. The idea that started 6 or 7 years ago was that we can be doing a much better job of improving the health and well-being of people with disabilities. Curative was asking that question. Bell and Health was focusing on that question at the same time, and that's really what drove this and the vision that we had, that we could work together to improve the systems of care around people with disabilities to help them have better health outcomes. Doing that within the context of social determinants of health. That is the idea that brought, frankly, competitors in the marketplace to the table, who embraced the vision and really stuck through some challenging times to get us to a really good place here now, some 6 or 7 years later.
Right. One of the things that was gratifying to us, I mean, certainly we were thrilled to be asked to be a part of this. One of the things that was gratifying to us is that it was our work with Lakeland Care and Inclusa that kind of opened the door for this opportunity. And we're essentially kind of bringing that health plan layer of data to the table and knitting it together a little bit in a minimal way to start. But I agree with you that there are huge opportunities for deeper collaboration. You mentioned social determinants of health. It's something that we've been looking at for a long time as another layer of value that we could make happen from our platform and as part of our services. So we're thrilled to be part of the Population Health Collaborative, and I agree that there might be a model here that could be replicated in other communities. And we've got a lot of infrastructure already in place that could enable that. So we are looking forward to how it evolves in Brown County and how it might spread to other areas as well. I don't know, Steve, if there are questions.
We do have a question, Steve. The question is, how does so I'm guessing that's, how does the collaborative put people on the care team, and how does the collaborative, or does the collaborative create an SER in Epic? I'm not sure what an SER is, but Steve, maybe you could address that. So restating, does the collaborative put people on a care team, and do you create an SER in Epic to be shared?
Yeah, it's just an interesting question. So a care team, what is a care team? It's everybody who's involved in that individual's plan of care. So Curative Connections, for every one person that we serve, we have our own care plan. Lakeland Care, as a family care organization, they have their own care plan. A residential program where that individual might be living has its own care plan. The primary care doc has their own care plan. All of these parts already exist. What did not exist was the awareness that we can bring these pieces together in a coordinated way and have a care plan that we can all be working from. So the collaborative itself does not necessarily create the care teams. Those care teams already exist. What we are doing is just bring to light that we are all on a care team for each one of these individuals.
There's an opportunity here as well, I think, where we can provide additional care plans as part of the care plan project that Joe mentioned in his opening for the HMO SSI population. That project is coming to a close, and we see this also being an opportunity to make available care plans from the health plans that can drive some of the data sharing and accessibility, as you talked about. Another question that came up, I apologize, that's sorry, that was for maybe KPI in Velatura. So I don't have any more questions for Steve, but thank you, Steve.
Right. Thank you very much. We're excited about what you're doing there in Brown County, and we're pleased to be part of that project. And I hope we can come back to this meeting next year with some interesting metrics. I think you guys are pretty good about doing the measurement, and I think everybody would be, I certainly would be interested in how things are evolving. So hopefully we can prevail upon you next year for a little bit of an update.
Yeah, I'd love to do that. I appreciate that and appreciate the partnership.
Thank you.